Did you know that millions of people in the United States are silently suffering from a condition that can rob them of their quality of life? Peripheral neuropathy is becoming increasingly common, affecting around 20 million Americans. This condition, which often starts with a simple tingling sensation in the extremities, can evolve into debilitating pain and even loss of motor function. Imagine not being able to feel your feet as you walk or losing sensitivity in your hands while performing simple daily tasks. But here's the good news: there are ways to combat this condition and protect your nerves, and today we're going to reveal the top vitamins that can make a real difference in your health. Stick with us until the end, because the last vitamin we'll present might be exactly what your nerves need for a true recovery. And before we start, make sure to subscribe to the channel so you don't miss any more health tips and ensure you're always one step ahead when it comes to taking care of yourself. Number 1. Vitamin D. Vitamin D is essential for the proper functioning of the body, and its benefits go far beyond bone health, which is what we usually associate it with. In fact, this vitamin plays key roles in the immune system, cardiovascular system, and inflammation control, and is also involved in cellular metabolism and neurotransmitter production, making it vital for neurological health. One of the most relevant aspects for those suffering from peripheral neuropathy is that vitamin D can directly help in the recovery and prevention of the worsening of this condition. Peripheral neuropathy is a disease that affects the nerves, causing symptoms such as pain, tingling, and loss of sensation, often in the lower and upper limbs. Vitamin D deficiency has been associated with increased sensitivity to pain and worsening damage to peripheral nerves. This is because vitamin D has anti-inflammatory properties, which can help reduce nerve inflammation and, consequently, decrease pain and other neuropathy symptoms. Moreover, vitamin D aids in the regeneration of nerve cells, promoting neuroprotection. This means it can help repair the damage caused by neuropathy, speeding up the healing process. In patients with severe vitamin D deficiencies, neuropathy symptoms tend to be more intense, with a slower response to conventional treatments. When adequate levels of this vitamin are restored, there is usually a significant improvement in sensitivity and pain control, as well as additional protection against further nerve damage. Another crucial point is that vitamin D also influences the release of chemicals in the brain that affect mood and pain perception, helping to alleviate symptoms such as depression and anxiety, which often accompany patients with peripheral neuropathy. The recommended daily amount of vitamin D for a healthy adult is around 600 to 800 IU per day, according to international guidelines. However, for patients with peripheral neuropathy or those undergoing treatment for neurological conditions, higher doses may be recommended, always under medical supervision, considering individual needs and avoiding the risk of toxicity from excess. It's important to note that vitamin D can be obtained in 3 ways: through sun exposure, consuming foods rich in this nutrient, such as fatty fish and fortified dairy products, and supplementation. For patients with neuropathy, regular blood tests to check vitamin D levels are essential to ensure the body is receiving the adequate amount of this valuable vitamin for the nervous system and overall health. Number 2. Vitamin B12. Vitamin B12, also known as cobalamin, is essential for various vital functions in the body, such as the production of red blood cells, protein metabolism, and DNA synthesis. However, one of the most significant roles of this vitamin is in the health of the nervous system, where it helps in the formation of the myelin sheath, a layer that surrounds and protects nerves, allowing electrical impulses to be transmitted efficiently. For people suffering from peripheral neuropathy, which is a condition characterized by damage to peripheral nerves, vitamin B12 plays a crucial role in prevention and recovery. A vitamin B12 deficiency can lead to peripheral neuropathy symptoms, such as pain, tingling, burning, and loss of sensation, especially in the extremities like hands and feet. This happens because low levels of this vitamin impair myelin production, leaving nerves more vulnerable to damage. Thus, correcting this deficiency can help reverse some of the damage and improve symptoms. In treating peripheral neuropathy, vitamin B12 has a neuroprotective function, meaning it helps protect nerves from further damage while promoting the regeneration of damaged nerve fibers. Studies show that vitamin B12 supplementation can improve nerve sensitivity and reduce neuropathic pain, providing long-term relief for patients with this condition. Additionally, the vitamin is also involved in neurotransmitter production, which are chemicals responsible for communication between nerves, which can improve muscle control and coordination, as well as reduce the discomfort that many patients experience. For adults, the daily recommendation for vitamin B12 is approximately 2.4 micrograms, and it can be obtained through foods like meat, fish, eggs, and dairy products, or, in some cases, through supplementation. Patients with peripheral neuropathy or diagnosed deficiencies may require higher doses, often administered via injection, to ensure the vitamin is adequately absorbed and reaches the levels necessary for nerve regeneration. It's important to have regular tests to monitor B12 levels, especially in older individuals or those with conditions that affect nutrient absorption, such as chronic gastritis or celiac disease. Vitamin B12 deficiency can be silent at first, but its effects on the nervous system can be devastating in the long term if left uncorrected, which is why proper supplementation is crucial to preserving neurological health and overall well-being. Number 3, Vitamin C. Vitamin C, also known as ascorbic acid, is widely recognized for its role in boosting the immune system, but its benefits go far beyond that. It is a powerful antioxidant, meaning it helps neutralize free radicals, which are substances that can damage body cells and contribute to aging and the development of various diseases. In the neurological context, vitamin C is especially important as it contributes to the synthesis of neurotransmitters, essential substances for communication between nerves, and also promotes collagen regeneration, a structural component that maintains the integrity of tissues, including nerves. For patients with peripheral neuropathy, a condition characterized by nerve damage, vitamin C can offer significant benefits. Peripheral neuropathy can cause pain, numbness, and tingling in the extremities, and vitamin C can help combat these symptoms by reducing inflammation and oxidative stress, which are key factors in worsening the condition. Vitamin C also plays a role in the formation of myelin, the layer that surrounds and protects nerves, ensuring they function properly. In cases of neuropathy, this protection can be compromised, leading to nerve damage. Vitamin C's antioxidant properties help prevent myelin degradation, which can improve nerve function and promote the regeneration of damaged nerves. Additionally, the vitamin has anti-inflammatory properties, which can help relieve the pain and discomfort associated with neuropathy, promoting faster recovery. Studies show that vitamin C supplementation, in combination with other therapies, can improve the quality of life for patients with peripheral neuropathy by reducing symptoms and speeding up the healing process. The recommended daily amount of vitamin C for adults is about 75 to 90 milligrams, but in special conditions, such as in the treatment of peripheral neuropathy, higher doses may be recommended, always under medical supervision. Vitamin C can be obtained through foods like citrus fruits, strawberries, kiwi, and vegetables such as broccoli and bell peppers, or through supplementation. It's important to remember that as a water-soluble vitamin, the body doesn't store vitamin C, so it's necessary to ensure an adequate daily intake. Vitamin C deficiency can lead to several health issues, including a weakened immune system and difficulty recovering from injuries. In the context of peripheral neuropathy, ensuring adequate levels of this vitamin can be a powerful tool to help with nerve regeneration and reduce painful symptoms. Number 4, Vitamin B1. Vitamin B1, also known as thiamine, is essential for energy metabolism, as it helps convert the food we eat into energy for the body's cells. Additionally, it plays a vital role in maintaining the healthy functioning of the nervous system. Thiamine is necessary for the conduction of nerve impulses and the metabolism of glucose in neurons, making it crucial for nerve health. When it comes to peripheral neuropathy, a condition where peripheral nerves are damaged, vitamin B1 stands out as an ally in treatment. Thiamine deficiency, especially in people with poor dietary habits or conditions like chronic alcoholism, is strongly associated with neuropathy, resulting in symptoms such as pain, tingling, and muscle weakness. This happens because a lack of thiamine interferes with the process of glucose metabolism, which is crucial for energy production in nerve cells, leaving the nerves more vulnerable to damage. Vitamin B1, in addition to being an antioxidant, also has a protective effect on nerve cell membranes, which helps prevent the degeneration of peripheral nerves. In patients with neuropathy, thiamine supplementation can improve nerve impulse conduction and reduce painful symptoms by promoting the regeneration of damaged nerves. The use of active forms of thiamine, such as benfotiamine, has shown even greater effectiveness in treating peripheral neuropathy, particularly in cases related to diabetes. Benfotiamine is a fat-soluble form of vitamin B1, which makes it easier for the body to absorb and enhances its ability to protect nerves from oxidative stress and glycation, processes that contribute to nerve damage. For adults, the daily recommendation of vitamin B1 is about 1.1 to 1.2 milligrams per day, and this vitamin can be obtained through foods like whole grains, pork, legumes, and nuts. However, for patients with peripheral neuropathy or conditions that increase the risk of thiamine deficiency, higher doses of supplementation may be required under medical supervision to ensure the recovery of affected nerves. It is essential that thiamine is administered in conjunction with other B-complex vitamins, as they work synergistically in the nervous system. Vitamin B1 deficiency, when untreated, can lead to the progressive deterioration of nerves, making prevention and replenishment crucial for maintaining neurological health and reducing the risk of complications. It's time to reveal the last vitamin in our video, but before we do, we want to hear from you. Give us a thumbs up if you're enjoying the video, comment below on which vitamin you think will be the most powerful on our list, and don't forget to subscribe to the channel for more content like this. Now, let's find out which vitamin will transform your nerve health. Number 5, Vitamin K. Vitamin K is commonly recognized for its essential role in blood clotting, helping to prevent excessive bleeding. Additionally, vitamin K is important for bone health, as it assists in calcium regulation and its fixation in the bones, preventing diseases like osteoporosis. However, what many may not know is that this vitamin can also play a beneficial role in the nervous system, especially in conditions like peripheral neuropathy. This condition is characterized by nerve damage affecting primarily the extremities, such as hands and feet, leading to symptoms like pain, tingling, and loss of sensation. Due to its anti-inflammatory and antioxidant properties, vitamin K can contribute to the protection and regeneration of damaged nerves, offering supportive help in the treatment of peripheral neuropathy. Vitamin K is also involved in the synthesis of proteins that help protect nerve cells against oxidative stress, one of the main factors worsening nerve damage in peripheral neuropathy. Oxidative stress results from an imbalance between free radicals and antioxidants in the body, and if uncontrolled, it can accelerate nerve degeneration. By acting as an antioxidant, vitamin K helps reduce this impact, creating a more favorable environment for nerve cell recovery. Additionally, the vitamin is responsible for activating proteins that regulate calcium flow within cells, a crucial process for maintaining nerve health. Inadequate control of intracellular calcium can lead to cell death and, consequently, loss of nerve function, something often observed in patients with peripheral neuropathy. The recommended daily dose of vitamin K for adults is about 90 to 120 micrograms, and it can be obtained through foods like leafy green vegetables, such as spinach and kale, broccoli, and vegetable oils. In some cases, supplementation may be necessary, especially if there is a significant deficiency. For patients with peripheral neuropathy, vitamin K supplementation can be a viable option, especially when combined with other neuroprotective nutrients, such as B-complex vitamins. It's important to balance and monitor vitamin K intake, particularly in people taking anticoagulants, as the vitamin can interfere with these medications. Although vitamin K is not a complete solution for neuropathy, its role in protecting nerves and reducing inflammation makes it an important component in an integrated approach to treating this condition. And now that you know the best vitamins for combating peripheral neuropathy, it's clear how proper nutrition can make a difference in your nerve health. Small adjustments to your diet and the inclusion of specific supplements can not only alleviate symptoms but also help in the regeneration of damaged nerves, improving your quality of life. Remember, Taking care of your nerves starts today, and with these vitamins, you can take the first step towards a future free from pain, tingling, or discomfort. If you found this content helpful, don't forget to like the video and share it with someone who might be facing similar issues. And of course, if you haven't subscribed to the channel yet, do so now to continue receiving valuable tips that can transform your health. Thank you for watching until the end, and see you in the next video.